Welcome back to Boppin Around with Ayesha
and Venus. Yay!
We're back.
Hey. And we have this little Valentine's Day bear, which is actually from last year's Valentine's, but, you know, I kept hold of it from Kenny, and we brought it in again for this Valentine's.
It's really cute. What an episode we have for you today.
Yeah, this is episode 6 from season 2. And, okay, wow. So, obviously, Valentine's Day just passed this weekend.
Happy Valentine's.
I think we were both doing very different things.
Oh?
Right?
What did you do?
Well, you know, not to sound pick me, but I celebrated it with my boyfriend, and we just cooked dinner in the house. We made vodka pasta and bruschetta. I make the vodka pasta. It's incredible. Damn. He makes bruschetta. He made bruschetta like one time, maybe like 2 years ago, and it was just so amazing that now that's like his staple thing to make. That. And those two go together, like the pasta and the bruschetta. So that was lovely. And then what did we do? We started watching Marty Supreme, which we didn't actually finish. We finished it then on Sunday night, which was literally yesterday. But we watched it and we kept pausing it and starting it. And Kenny always says, like, don't do that with movies. Like, it just ruins it. And I will say with Marty Supreme, I do think it kind of ruined it because it feels like you're supposed to just watch it. It's very, like, anxiety-inducing, fast-paced movie. And, like, because we kept pausing it, kind of, like, ruined, like, the vibe of it. But it was good. But I just couldn't help but think, like, and I saw someone else say this. I think it was the Apple girl, the girl that made the Apple dance. Kelly is her name. I'm pretty sure it was her. When she saw it, she came out and she was like, the whole time, she was like, it's great, but I just couldn't help but think, like, a woman could never get away with this. Ooh. Like, a woman could never do what he did. And it's just, like, so interesting because there is parts of the movie where you're like, especially one scene. I mean, will I spoil it? Like,
I mean, try not to spoil it too
much.
much.
She's always like, do I want to see this? Babe, are you just going to keep saying this about everything for the next, like, for the rest of our lifetimes?
I mean, I've watched a lot of...
Until she goes and watches it. Okay, anyways, yeah, but so, like, there's just a scene in particular that really brings up the whole idea of, like, a woman getting pregnant and how the man can just get up and go. Like, he doesn't need to be... He can basically just drop his cum wherever... Okay, let me not get too graphic, but he can just get someone pregnant and then fuck off. Whereas a woman is stuck with that, like, choice, which is... Like, just it really hammers home why abortion needs to be a choice for women. Or, like, it needs to be an option. Like, allow women to decide. Right. Anyway.
Shout out to Love Island. It's just so entertaining this year.
I'm not watching it.
Okay, Venus.
I'm not watching it. Like,
I know
I'm not
you're
in the loop of it.
I am.
I lost interest in Love Island.
My favourite girl as of now is Leanne. She knows what she wants. She's beautiful. And she is very, like, straight to the point. You know, she doesn't want a triangle. She told her man, I don't want any triangles. And her man is just forcing her into a triangle. She's moved away from that. Good for her. Honest to God, she is gorgeous.
And this is the All-Star season.
All-Star season. My favourite boy... The men are just so terrible.
Why would a man be there?
Why would a man be there? Kieran. Maybe Kieran.
Is he Irish?
No, Jack is the Irish one.
Kieran sounds like an Irish
Jack
name.
is very interesting because he's a bit shy, but he's also, like, he's got game.
Oh.
Yeah.
Okay, that's nice. I like that mix. Okay, well, I wasn't watching Love Island, but what I was watching was Wuthering Heights. I went to see Wuthering Heights yesterday. And it was kind of like a little continuation of Valentine's Day.
Okay.
I just wanted to go see, like, I'm not even that really big into, like, movies and the cinema and stuff. Like, yes, I love going and watching movies that I know I want to see, but, like, I'm not someone who's, like, super obsessed with movies. Like, I'm not a movie watcher. I think it might be a little bit of my attention span issues, potential ADHD. I don't know. But anyways, we went to see Wuthering Heights in the cinema. I just wanted to go see it because, first of all, I studied the book in school and I hated it. Like, I hated it.
I didn't even know it was on a book.
We talked about this before and you told me you had no idea what Wuthering Heights was. You and Kenny never even looked at the book. And I was just, like, thinking that's crazy because it's, like, she's set in England. Therefore, I was like, oh, well, if we're studying it in school in Ireland and I know they do it in America and stuff, I'm like, how the fuck did you not do it in school? But like maybe it's for the best. Well, no. To be honest, like I look back now and I'm like, okay, I'm glad that we did it. But I
Right.
really hated it at the time. I had no ability to understand it because I was literally like 17 years old and I was like so confused by the book and I just couldn't get my head around it because like it's talking about like like intense relationships, like toxic kind of relationships. Like I'm not gonna understand that at that age. But over the years, I have reflected on it and thought like, oh, I kind of understand parts of it now, you know. I have watched one of the movies. There's a few Wuthering Heights movies. There's a few adaptations, right? Okay. None of them have really ever told the story exactly.
Right.
But I've seen one of them, the one with the girl from Skins. What's her name again? Is it like Isla Scaris?
Which girl in Skins?
Effie, is it? Effie?
How does she look like?
The brown hair. I can't remember what her name is.
What was her ability?
Oh, bitch. What ability? I think you're thinking of Misfits, is it?
Oh, yeah, I am.
Jesus, okay. Anyways. Let's get her name, sorry. I watched it with my friend. Now, this was a while ago. But I was definitely at least early 20s. And according to someone that was in the room, I don't want to specify who, they said that I had no idea what was going on. So I must have had no idea at that age either. Now, I do think the movie that they've recently made, obviously with Margot Robbie and Jacob Elordi, probably is a bit more like maybe easier to understand. I don't know if that's just because I'm older now and I get it. I don't know, but let me just search up her name, sorry. Kea Scodelario. But yeah, so the thing is that I didn't really know what to expect with the movie, but I did hear a lot of controversy about it. About people saying like there's no point of watching it, right? And I was kind of like, okay, I wonder why that is. I didn't really want to go too deep into it. I just wanted to go in and watch it.
Right.
Now, I didn't really remember a lot about the book. Obviously, it's been so long since I ever would have read it. To be honest, I didn't even properly read it. I just would have like learned the summaries that my teacher, like I had to write fucking essays in my like leaving cert exams, like about fucking
What year were you
Heights.
in?
This was 2013.
So what year? That's in like what year group? Was in year 10, year 11?
Bitch! This is what I hate about the UK. They think that like everyone just does the same school system as them. Okay, this was 5th year and 6th year.
Okay, so are you like 10 years old? Are you 12? Are you?
Bitch! I told you I was 17 years old.
17.
Okay. Anyways, look. Like, I didn't really remember the book. The thing is, I remember in school. I remember specifically the day being. We were in a different classroom than our normal classroom too for some reason, and I remember the teacher asking me, "Please explain to me that this specific chapter. Like, what was your understanding?" And I just sat there like, so my understanding is that Kathy went down the road, and he's like looking at me like, "You didn't read it, did you?" And then I was like, I don't know what I said. It was like... Okay. Now, obviously, the other part of the movie that I really wanted to see was the fact that Charlie XCX's music is in it. She made a whole album. I was listening to it over the weekend before actually going to the movie, and I was like, wow, I love everything about it. I love the songs. A few of them really stand out to me. Like, Out of Myself, I think is my favorite one.
Okay.
There's other ones too that I really like. Alter, obviously Chains of Love, You Love House.
Thank you.
Dying for You is good. Like, it's just really nice, and it's like different from her typical kind of sound,
right? But
also it still sounds very much like her and her very first album that she ever put out, True Romance. It's like she even confirmed that they're basically sisters, those two albums. So yeah, so that was another thing that drew me into it. But then so we watched the movie and I loved it. Like, I loved the whole experience. I thought it was amazing. I thought they had great chemistry together, Margot Robbie and Jacob Elordi. And then, like, I didn't know if Kenny was going to like it because he actually didn't even really want to go because he heard bad reviews. But he ended up loving it as well. Like, he ended up loving it. So we come home and we're like, right, let's look into these bad reviews, okay? And we, like, watched this one girl's video and, like, I don't know, we just really disagreed with what she was saying. Now, like, she was saying, like, there was no chemistry between the two actors, which I just don't think is really, like, I didn't find that. I know everyone's entitled to their own opinion, but I didn't find that. Now, the main criticism is that it's not like the book at all. Which, like, now that I looked into more about what the book was actually about, I'm like, okay, that's fair. Like, it actually kind of is a bit... It is different.
Okay.
Like, for example, in the book, Heathcliff and Kathy never actually kiss or do anything. But in the movie, you know, they're fucking, like.
Okay.
So it's like, okay, so it's different. And maybe they went in, I don't know how this movie exactly was promoted in terms of the book, if they made it seem like it was going to be very like the book. So I understand people being annoyed by certain things that were changed. There was other stuff changed as well. And then also, it's only the first half of the story. It doesn't do, the actual book goes generations after like the first people that you come across, like Kathy Heathcliff and other ones. Like, it actually goes down into their children and stuff like that, like,
right.
And I forgot that part, but I had a feeling coming out of it being like, oh, I can't believe it ended like right. I don't want to spoil it. See, Ayesha doesn't know about the book, and if you watch it, I feel like I don't want to ruin things for you.
Okay, don't.
So I won't say anything, but the ending is very emotional of the movie. But I was like, this isn't the end, is it? It was the end. And I was like, oh, okay. I could have sworn there was more in the book. Like, and yeah, there is. There's a whole, basically, other half.
Right.
And like, I think there was also a bit of a controversy too when it came to the casting of Heathcliff, because they casted Jacob Elordi, who's white, and Heathcliff was supposed to be. Now, I don't know, there's a bit of a mixed opinion on what he was supposed to be, but he definitely wasn't white. He was either, I think, brown or black.
Right.
And people were like, why was he not casted properly? Like, that is a fair point. That is a fair point. The thing is, I don't remember exactly how much the racism part of it was involved in the book. There was definitely a big part about classism. But yeah, so that's like a valid criticism for like, in reality it is. But like, all that aside, I just don't see how you could go and watch this movie and think it was a bad movie, because I don't think it's bad. I think it's really good, really beautiful scenery, really like lovely costumes, everything. Like, if you didn't know anything about the Wuthering Heights story, you would go and watch this and enjoy it, and like the way that it's done. So yeah, I don't know. I enjoyed it. I really liked it.
I have a question.
I would rewatch it.
So, would you say it's a romance kind of film?
Okay, I'll just refer to the movie in particular because, you know.
Yes. Would you say it's a dark romance?
Yes. And like, I think it constantly changes and evolves. Like, at first you're like, see, babe, a lot of this is going to be spoilers. Let me just try and word it in a sense of like, there's parts where you're like, wow, romance, beautiful, wonderful. And then there's other parts where you're like, this is really
fucked up.
Yeah.
I love dark romance.
I think you should watch it. I think you should watch it. And like, I just thought they were both really good as their characters. Like, I thought Jacob was amazing as Heathcliff. I know, like, I got controversy aside, like, I think he played the role really well. And then also Margot Robbie, like, I was just watching it being like, it's crazy that she played Barbie. And like, I think she's very versatile, that she can now go and play another completely different character.
Right.
I think some people were saying like, oh, like she was miscast, like Kathy should have been casted as someone else. I don't know. I think it's crazy because, like, you know how they say like even when Wuthering Heights the book came out,
right,
it got so much negative reviews because it was probably way too like out there at the time. I think it was written in the 1700s or something.
Okay.
I can't remember. It's set in the 1700s. I can't remember when it actually came out.
Okay.
But like, got so much negative reviews probably for the stuff that it was talked about in the book. And I do think sometimes like there's probably stuff that like we're all hating on right now that in 100 years time we'll be like, oh wow, it's incredible or whatever. But that's like the beauty of art and how everyone can have different opinions and stuff like that. Did you go see Wuthering Heights? What did you think about it? I think like I can see the criticism. Some of it I agree with, some of it I don't. But if you just take it as a movie as itself,
right,
great. But that being said, it wasn't a fully true adaptation to the book, and I think that's what really grinds people's gears. I think
grinds my gears.
And I can understand if you really were like, this is my favorite book. Because there's certain books that I can think of where I'm like, if a movie was made, I'd be like, oh, why didn't they do it? Like, you know. So I can understand that part.
That's very interesting.
There's a very interesting scene in it. I think you would find it very interesting. Wait. Let's just say the word dog. Yeah, dog.
Okay.
If you've seen it, you'll know what I mean. She looks petrified.
Explain.
She's like, I'm just a little virgin. Anyways.
Doggy.
No, not like that. No, you'll see it. You'll watch it and you'll understand.
Okay, I watch it. with Sadie. Fingers
I was just
crossed.
gonna say Sadie. It's like we telepathed.
Yeah, okay.
Anyways.
Would you recommend me watching it?
Of course.
Okay. How long is the movie?
2 hours and 16 minutes.
Good to know.
But it went by so quick.
No, that's fine.
At the ending, I was like, is it actually over? I was like, it's not going to end here, is it?
I personally think, you know what you said about the fact that there's more generations?
Yeah.
There's probably going to, if it does well, they could do additional movies.
That's true. That's very true.
But sorry.
Because the whole point of the next generation is it's supposed to show that they break a generational curse. Like the next generation does that kind of thing. So.
Wait.
I never even considered that. Like, that would be interesting, but...
Who knows? Maybe I'll read the book first.
Yeah, maybe.
It won't take me
I want
long.
to see how you would
Yeah.
understand it now. Like, or like, you know what I mean? Cause,
I'll just download it onto like my iPad or my Kindle and I'll just read it.
do you have a Kindle?
Yeah.
When the fuck did you get a Kindle?
6 years ago?
Oh my god.
7 years ago?
Wow. I don't picture you as a reader.
Oh, I'm a big reader.
Okay, read it. Yeah,
I will.
fucking read it.
I'll have a look tonight.
Yeah. Now, the movie will be different to it.
That's
but
fine.
Yeah. Okay, so anyways, that was that. Now, Ayesha, get into everything that's happened to you. This girl has gone through it. Let me tell you. It's actually scared me. Like, it's scared me a lot. Right. There's two main situations that went down with you.
So imagine this. You're in a dingy hospital emergency room, packed to the brim with lots of people. You've been there for about 14 hours. You haven't eaten, drank anything, slept. You've got like cannulas stuck inside you. The doctor's taken your blood. You've been given an IV drip. You're terrified because you don't know what's going to happen. You've been informed that you might need an ultrasound and that you have to go to another hospital. What the fuck happened? How did I get here? Right. So I went to the hospital because I had a severe issue with my thigh, specifically my left thigh. It inflamed so badly, became purple and red, rock hard, and it felt like it was
and this
extremely
is
hot.
after, it's interesting because we've been speaking about it throughout every episode
Right.
this season, basically.
Right.
After your
is
hormone injection.
After my hormone injections.
So as Aisha's been speaking about for the past few weeks, like,
Right.
you know, you were like, I'm going to start the hormones. Okay, the hormones came to my house. Okay,
Yep.
I actually injected. Was that last week's episode? Or maybe it was 2 episodes ago where you said, like, you injected. But then, like, maybe early last week, you were like, babe, I really didn't feel well over the weekend and my leg is really sore and, like, it was really inflamed. And
Yeah.
you were like, it's going down.
Exactly.
It's going down now, but it was so inflamed. And I was like, babe,
Yeah.
that's really serious.
Yeah.
Like, you don't want to fuck around with inflammation in your body
Exactly.
like that. Like, especially when you know that you've used a needle and injected yourself. Like,
Yeah.
this is fucking serious. But you were starting to feel better.
What? Yeah. So essentially, what happened was after I injected, I was a bit sore, but you know, fast forward like a week and a half, maybe 10, 12 days, I'm filming my social media content, my Valentines content. I'm getting very frustrated because I feel like I've got a cold, I've got a fever, and I'm like,
That was a reaction,
yeah,
for sure.
yeah. And I'm always like very precautious. Like I don't like to get ill, and I know when I'm about to get ill, but this hit me just suddenly.
Yeah.
And I was very surprised. I was like feeling so unwell. I had to sleep all day, not see any clients. I filmed a bunch of content. I pushed myself really hard to do it. And then after, I was just like, I'm not doing it. So for anyone watching, if you saw a TikTok or a reel or a Twitter post of mine where I'm like, I'm not crying, I was crying a little bit.
Yeah, I thought that seemed like you were actually crying.
I was a little bit.
And I was like, what is going on here?
That was a start.
Why were you crying in that moment? You were just like...
I was crying. I was technically not actually crying. I was sneezing and sneezing so much, and I felt so dizzy, and I felt like I had a fever. I felt so unwell and overwhelmed to the point where I was like, what is happening to me right now? I really need to film. I really need to see clients.
Yeah.
But I feel like I'm being dragged down. And I was like, okay, after I filmed that TikTok, I was like, I'm going to take a little break. So I got into bed and I just slept it off. And I noticed that my thigh was hurting, and I thought, not much of it. I thought I felt a little bit better because I had a little nap, and I pushed myself to make my Valentine's Day content. That's all on my OnlyFans.
It's like, a subscribe. The
yeah,
fuck?
literally. And if you see me wearing my red outfit for Valentine's, there's a few videos where I talk about, ha ha ha, oh, my thigh hurts, can someone massage it? It was actually hurting.
Can someone massage it? Like, no. I feel like that would make it worse.
It did make it worse.
Oh!
It did make it worse.
Did someone massage it? Did someone come over?
A few days before that, yeah.
Right, yeah. Jesus.
Yeah, it was terrible. So I massaged the thigh, I exercised, and then, you know, I had a lovely hot shower, obviously, the day before, and everything shower, girls, you know, everything shower, steamy and everything. And then the same day, it was like really red and really big. It looked like my leg was pregnant. It was fucked up.
Yeah, and I think the photo you sent me where you showed me it had already gone down a bit by that point, hadn't it? Or something, I think it had.
It started getting more worse.
Oh. Okay,
wait, I mean, wait.
Oh no, because I think you were going through this. I remember because I was texting her and then you would respond, but you wasn't really responding to me. You were just going, hi. And I was like, babe, you're going to respond to everything I said? And you're like, babe, I need some time. I'm really unwell.
Oh yeah, I was like,
and I was like, oh my God, I'm not going to hear from her for months. Like I really was like, oh my God, like the podcast is over. I'm not going to hear from her for months. Like I really was like, you know, because I'm thinking back in the past when you said you needed some time, that was why I was like, okay, no. Because I thought you meant more mentally, you weren't feeling great.
Right.
But, I mean, obviously it was affecting you mentally too, but
Big
you
time.
actually were going through this thing. And the thing about Ayesha is she won't explain anything. She will just say something like that to you and she won't give you any details or understand.
Part of me saying hi.
Babe. When she was in hospital, I asked her like at least 10 times, just please, in one word or less. In one word. In one sentence or even one word or less. Just tell me what's going on. She goes, that was it. Then she started talking about how the devil came in her leg, and I don't even know. No,
I said Jesus came in my leg.
Oh, you said something about the devil.
Oh.
Okay.
Damn.
Anyways.
Right. So I told Sadie what happened, and I showed Sadie, and Sadie looked at it, and Sadie was like, "Bitch, what the fuck?" And this is before I told you. Sadie was like, "Bitch, what the fuck? You should go to A&E."
And Sadie's like so nonchalant about stuff as well.
Exactly.
So I'm like, if Sadie was like, the fuck?
Exactly. If Sadie's shocked, then something's wrong. So I'm like, well, I think, Sadie, what I'm going to do is I'm going to just like wait it out and see. I feel like the inflammation has gone down. And what I started to do by then, I started to mark it with a pen, different coloured pens. So first of all,
that's a good idea.
Right, I coloured it in black, a black circle over the inflammation. A few hours later, I coloured it in red, and then a few hours later, I coloured it in green. And it was going down eventually, little bit by little bit. That initial inflammation, from what the doctors told me afterwards, was mainly because of the fact that the medication was... We'll get to that actually. The medication was irritating my muscle fibers, and that's what the initial inflammation was. But after a certain time, after 4 a.m, because me and Sadie were playing games all night to try and calm me down, it didn't go down. And I hadn't slept, and I thought, let me not sleep, because the day after I want to record the podcast and I want to be waking up on time. So I spent the day with my dad, you know, doing some stuff with him, and then at 2 p.m. I thought, I think I'm going to go to A&E. I'm going to go to Accident and Emergency Services.
Yeah, because that was why you had already told me, and I was like, is there someone you can call? Can you get in touch with someone? Like, anyone that can just give you some advice right now? Like,
it was scary. Yeah. It was really scary because I couldn't walk. I was limping.
That's crazy.
You know, and I realized, like, if I was limping so badly, how am I going to get this fixed? You know, I need to understand, is this going to go away? Because the swelling hasn't gone down. It went down a little bit, the inflammation, but the swelling hasn't gone. The inflammation has stuck to a certain point and is starting to feel a bit hard. My thigh feels a lot hotter than the opposite thigh.
And all I could think about was just, like, seeing this happen in terms of, like, say, like, surgery. Like, what I was really thinking was, like, you know, when something goes wrong with surgeries, plastic surgery, or like this one particular girl I'm thinking of who got bum filler, and it was like her whole booty cheeks just completely inflamed. Like she almost died because she got an infection. I think it's sepsis. Yeah. And like, that was what was coming to mind. That how like when you have open wounds or when you are injecting things with a needle, like it needs to be so like it needs to like like no bacteria whatsoever. Like
I know what mine was. So you mentioned sepsis. Mine was the early stages of cellulitis.
Sorry, that's what it is. Cellulitis, not fucking sepsis.
Yeah.
That's what she had.
Okay.
I literally can show you. I mean, maybe you don't want to see
fine.
me,
No,
but
that's fine.
cellulitis. What is
Right.
it exactly? It's when bacteria, bad bacteria gets into your bloodstream, isn't it? Or
Yeah.
something? And people get it a lot in hospital too, I think, because but it's like, I don't know, that just instantly came to mind. I was like, fuck, like, because you injected yourself at home, like, and your whole leg is inflamed. So they told you it was the early stages?
Yeah.
Bitch, you never fucking said that word to me once.
Now we know.
This is what I'm saying, she don't explain shit.
Now you know.
Okay, I know now, anyway.
Now you know.
Yeah, I know now.
So, I went to...
That's so scary.
No, it is.
You're
It's
like, you're
terrible.
lucky in a sense.
Yeah.
Like, very lucky.
Cool.
I think it's a good thing as well that, you know, you went and you were like, you know what, I might be getting better, but let me still just go and check it out.
Big time.
Yeah.
And I feel if I do go and get it checked out, at least now I can talk to medical professionals about me injecting myself with my medication, right?
Yeah. But yeah, so you went into A&E. What happened from there?
I went to A&E and then I told the nurse, hey, so I've been doing this and that. And she's like, I told her I injected. And she looked at me weird, like I injected like heroin or some shit. And I said, no. I injected estrogen because I'm transgender. She was like, oh, okay. And I gave her all the information and she said, okay, cool. I'm going to move you into the main A&E waiting room. So that was done. After that, you know, you have to wait for a certain amount of time.
You were waiting for a
long time because the A&E
the whole
system,
day you were there for.
I was
into the early hours of the next morning.
Right, I was at this hospital for 14 hours.
Wow.
Bearing in mind, I went to a second hospital, but we'll get to that. So
3 hospitals, no?
Technically just 2.
You told me 3.
Okay.
You
3 well.
You said that on sorry. You said that on TikTok.
If I have to count, it was like 2 departments, 3. So 4 departments. 4. Shit, it was 5 departments. 5 departments, 2 hospitals.
Okay.
Right. 1 bimbo slut. So I got my blood taken. You know, they took my blood and they stuck a cannula inside me, and it was just can you see that?
Oh yeah. I can
that there.
Ooh.
That's there. It was in me for do you know how long? Approximately 8 hours. Just flapping about. Pissed me off. First, no, literally.
This area of the arm, I get a little bit.
Oh, let me tell you something, Venus. So, I get so nervous when I'm at the doctor's. If I'm smiling and happy, that's because I'm being so brave and pushing myself.
Brave girl.
So brave, but I found it very scary, very nerve-wracking. That was inside me for so long. When she was taking blood from me, the nurse, I literally looked away. I was just like, I can't do this. And then I look back when she's done, and then I'm like, what? And I looked away so quickly. I said, are you not going to take that out? She said, no, we're going to keep it in just in case we need to use it later. And I'm like, what?
You're like...
I was like, what the fuck? So then I was just freaking the fuck out. So I didn't tell you this. I'm sitting in A&E, turned away to the side with my hand like this. I'm literally on my phone, 180 away from my hand. And then, you know, sometimes I look around and I see that and I'm like, holy fuck. Everyone obviously like is, you know, can be squeamish to an extent, but I'm very squeamish. So I'm just like, I really can't look at that thing sticking out my arm. So for the next like 2 to 3 hours, I was like that. I calmed down and I was like, okay, it's not that bad. I'm okay. I'm still alive. I'm going to be fine. So after that, they decided to get a doctor to me and chat, you know, let's talk about what happened. I told her I injected estrogen, blah, blah, blah. I showed her my video of me injecting and I showed her my medications, my needles. She said everything is fine. She said the biggest issue is probably you injecting and that the site wasn't clean enough. At the time I was thinking, well, I did clean it a lot, but then following that meet with the doctor, I realized perhaps I didn't clean it adequately enough. If I'm here in the hospital, something went wrong, right? So For those listening, there's two types of injections, subcutaneous and intramuscular. So subcutaneous is shortened as sub-Q and intramuscular is shortened as IM. Sub-Q injections are when medication is injected into your fat layer, and intramuscular is when it's injected into your muscle layer. Now, the medication that I injected is a long chain ester. What does that mean? It means it has a long half-life, which means it breaks down over a long period of time, which means you don't need to administer the medication as frequently. That's what it is. Now, she suggested that I change my needle to something that's thinner and shorter and to inject into my subcutaneous layer, to my fat layer. And I was like, okay, I will do that. I was just worried because I don't know if I injected it properly. She said, it looks like everything you've done was perfectly fine from the video. Just the only thing I would change is squeeze your thigh a bit more, right? Because the original tutorial video I watched, the man had a lot of fat on his thigh, so she didn't have to do it much, but I don't, so I kind of have to like pinch it a bit more and inject it.
Yeah.
And she was like, did you shave the area? Did you exercise? Did you have like a hot shower? And I was like, doctor, I did all of that. She was like, that's why. It's because the medication is quite thick, you know, and it must have gotten irritated with the muscle fibers, causing the inflammation. And I was like, okay, so is this an infection? What do you think? She said, well, how was you feeling? And I said, I don't want to admit it, doctor. I really don't want to admit it, but I'm going to be honest with you. I was feeling very poorly on Friday. Very poorly. And I was like, I had a random fever. I couldn't like control myself, you know, and I really was feeling unwell. She was like, that's a sign of the infection.
Like, even to bring it back, I love when I do this, even to bring it back to me.
Okay.
No, like, when
I'm always curious as to how she's done it.
Find a narcissistic friend today near you. No, when I experience a flare-up of my embedded UTI, which I kind of actually am feeling right now in this moment. But when I'm experiencing like a flare-up, normally like quite like a more on the worser end of a flare-up, it's like I live with constant teeny flare-ups, right? And I just take my hip recs and I move on my merry way. But like, you know, sometimes it flares up a little bit more than that, where I need to sit on the toilet for a long time and like drink so much fluids and stuff. And I can feel feverish symptoms. Like UTIs can really make you feel sick. And they also can affect your brain. You feel very foggy and stuff. But the fever that comes with it as well is interesting because your body is fighting it, right? So like,
that's terrifying.
Like again, it's the same thing. Bad bacteria. It's trying to get rid of it, and that's what your body was.
I hate that shit. Infections are the worst. Sorry, babe.
I know, it's kind of crazy that I'm just.
I should recommend my ex to go on Hiprex.
Would you text her and be like, "Hey, just letting you know"?
No.
I just wish they talked about Hiprex more. But anyways, babe.
Right. So back to that. She was like,
you had a fever.
Yeah, you had a fever and all of this.
Yeah, you probably,
And I told her, look, I injected this amount of days ago. And she was saying, yes, it all makes sense. And obviously, after the entire experience, I kind of was reflecting on the interactions and the meetings I had with the doctors. And I was thinking back to when I was studying A-level biology. And it's something that we used to like learn about, how even if you had, and I was telling Venus this before and I was talking to Sadie about this, even if on day 0, there's one cell of a bacterium just sitting inside you, over a certain amount of days, that one cell would have replicated so many times that by a certain amount of time, you're going to feel the infection, you're going to get a fever. And for me, it was day 12, day 13, day 14, something like that, which it all made sense. And I was like, I think my issue was that after I cleansed the area, I didn't let the alcohol dry and I actually wiped it with a cotton pad.
Yeah, that's insane though, because you were just doing what you had seen
from
as the
video.
Advice.
Right.
So like, now that video was a bit wrong then.
And you can't even comment on it because the comments are disabled. So.
Because everything else, you're like, it couldn't have been anything else.
Right.
Jesus.
Literally.
Yeah. I mean, unless the cotton needs to be like Was the cotton sitting somewhere
The cotton.
funnier?
The only thing which was what?
No, sorry, just the smile on your face. I was like, what are you about to say?
The only thing out of all of the pieces of equipment that isn't like inherently safe was the cotton pads. And the cotton pads I hadn't even thought about. It was just something that was on my desk.
Yeah.
Right? Whereas the needles, the injections, the medication, the alcohol wipes.
So how would you dry the area then if it wasn't?
You let it dry.
You
just wait for a few seconds, let it dry.
Right.
Just let it dry.
God, it's crazy.
No, literally.
But like they use cotton. I'm just thinking like normally if you get injected in the doctors or whatever, they use cotton. They normally could put cotton on it after and then like tape it over. But I guess
my cotton pad was just sitting out on the table and I don't know how long for.
Okay.
And bacteria is airborne, right?
Yeah, so the cotton pads, I guess, like
especially in the doctors, they would have those in airtight, proper, secure locations.
It
to
really
make sure
goes
that they're
to
clean.
show.
Yeah.
Okay, so I guess that video, in a sense, like is more like you can use cotton, but like, I guess if you're saying it was sitting out, then like it obviously did introduce some. Even just one little fucking cell.
One little guy.
No, that's like science. We were talking about science earlier, and I was like, it's just mind blowing.
I love science.
But okay, so then, and when did you get told then that you had early stages of cellulitis?
Then.
Okay, so you did a bunch of different tests and scans.
So that all came after. She said to me that there is a very small chance that I have an abscess. An abscess being, let's say, when your body fights back against the infection, creating all this pus and stuff, that's the abscess. And, the initial assessment will put you through certain like hoops and barriers for the NHS to decide which department or which specialists are going to see you. So for me, it was the orthodontics, the bone department, because that's how they kind of like ticked it down. Okay, it's something wrong with her bone. And she was like, well, I'm a doctor which specializes in orthodontics. I hope I'm saying that right, but the bone department basically. And as far as I can tell, without any x-rays or ultrasounds, the bone feels fine. It doesn't seem like there's an abscess. I don't think there is. But what I'm going to do is I'm going to speak with my superior and we're going to see what can happen. But for now, we're going to put you on an antibiotic IV drip to make sure that there is antibiotics in my bloodstream as soon as possible to reduce the infection and to prevent, further stages of cellulitis. So they did that. I still had the fucking cannula in my arm. So they just shoved me in the room with the cancer patients and then...
Wait, really?
I mean, everyone was...
You were just sitting there with other people. So sorry, did you have like a little thing that you were walking around with?
No, I was in the room. I didn't have to walk around. I was sitting with it though. It was so creepy. I was losing my mind.
I've actually never had one of these. Like, I feel like, okay, on one hand, like, touch wood, I'm lucky that I haven't had to... But also...
Honey, it's so weird.
Yeah.
I cannot describe it. So do you remember when I was like this?
Yeah.
With the cannula just sitting there after they took my blood? When I was sitting down with the IV drip, I was literally like this. And I had my iPad up to my face because I couldn't do anything.
One thing about you, you're like, you know what, you can do it, but I just can't look. It's like if I was to use your lip gloss right now, I'd be like, you'd be like, okay, I'm just going to look away.
Yeah, because it freaks me the fuck out. Freaks me the fuck out.
Even when I use your lip gloss?
Yeah.
Why does it not freak you out?
I don't know. It's just freaky.
Stop!
Look, I was sitting there for about half an hour with a fucking IV drip. And I was watching, you know how you watch that movie, Marty Supreme? And you said it's like a high anxiety movie. The night before, I was watching this movie on Netflix called Mama. Or Mother. Mother, it was called Mother. That movie is also very high anxiety. So as soon as I sat down with the fucking drip in my arm, I was like, let me watch my movie. And I was like, holy fuck, how am I watching this? I can't watch this. It's such a high anxiety movie. I had to turn that shit off and find something else to fucking watch.
I was going to say you should have watched I Love LA. You still need to watch the rest of it.
True.
That is a bit high anxiety too, though, in a sense.
Yeah, no, I put on Superstore. And then it felt like it took forever, but then I saw that my drip was finished and I was like, it must have been 20 minutes from now. And I was just screaming, nurse, please, nurse.
Were you?
Yeah. And the nurse came and...
Was the other patients like, the fuck?
all the other patients were kind of freaking out in their own way.
Oh, okay.
You know, me, I was probably the most like visibly.
You
freaking
basically
out.
went to a 2-day festival, but in a hospital.
Fucked up, babe. Fucked up. And
Fucked up.
meanwhile, I have her and Sadie just texting me, and I'm like, I don't even know what the fuck they're saying. I'm just like replying.
She's out of it.
I'm out of
but
it.
it's crazy because I was like,
I appreciated it though.
I was like,
because
babe, I'm worried. Like, what's happening? Are you okay?
It took me out of the NHS bubble for a few minutes, you know. But after the IV drip, you know, I went back and saw the doctor and we spoke about it. And she said to me, listen, here are some antibiotics for you. Now, I spoke to my superior. You can either do one of three things. One, and I highly advise that you don't do this. You can just walk home now. Go home now. Leave it. I highly, highly advise you don't do that. Two, you can wait for us to arrange transport, aka an ambulance, and we're going to send you to a different specialist hospital to do x-rays and ultrasounds. Or three, you can go there tomorrow or the day after in your own time, but there's a big chance you're going to have to repeat the whole A&E process again. And I was thinking in my head, I just spent 14 hours in the hospital. I might have to repeat that, or I go now with the ambulance. Most people would say, oh, let's take the ambulance, you know, they're going to let me sleep in a hospital bed and everything. And
Imagine, oh my God.
But I said no, because at that point, it had been 14 hours of me away from my cat. Right? And I needed to check on her. I needed to feed her, make sure she's okay.
Mm-hmm. She's
right?
a parent after all.
Yeah. So I expressed that to her, and she's a cat owner too, and her cat's name is Mish Mish.
Mish Mish?
Mish Mish.
Interesting name.
Yeah, and she was like, don't ask me how. Don't ask me why her name's Mish Mish. And I was like,
does she call her Mish for short, or just Mish Mish?
I don't know.
Mish Mish.
We never really spoke about
Mish
it much.
Mish. Mish Mish.
And
Mish Mish.
yeah.
Kind of sounds like Mish Mish.
Mish Mish is a very common name. And
is it? For a cat?
Yeah.
Oh, I never heard it.
I have. You're a dog family, so you know. Anyway, she was very sweet, and I said to her, Doc, if I'm honest with you, I am going to be going home. I need to check on my cat. She said, no, I totally understand. I had a feeling you was going to say that. I'll help sort things out for you. You know, I'll make a call to the hospital, the following one that you're going to go to, and I'll let them know that you're coming so that they can expect you. I'll give you some discharge papers so you can give it to them and get everything done as soon as possible. And I was like, thank you so much. That does really help. And she said, just wait a little bit longer so I can confirm everything and then I'll let you go. And that happened. I went back home, found my cat. She was pissed the fuck off. It was
Cats are so funny. Like,
honestly, it was like 5
cats
in the
are
morning.
like, we don't do the unconditional love that dogs do. Okay, you better treat me right. They actually have some self-respect.
Yeah, they do. It was like 5 a.m. and she was like, what the fuck? And usually my cat is like, she's pissed off for a few minutes and then she gives me love. But this time around, she was not having it.
She's like, you took my blanket. You pissed off for like a whole day.
Pissed off for a whole day, mum. What is going on? And now it looks like you're going to go out again. Because the thing is, you know, she can only chill with me for so long. I can't keep her in my room. That's inhumane. If she needs to go potty, she always goes outside. And if she wants to run around, there's obviously not enough space in my room. You know, if she wants to go see her boyfriend, what the fuck is she going to do? Do a fucking Romeo and Juliet where she looks out the window? No fucking thank you.
There's a really funny scene in Wuthering Heights about Romeo and Juliet.
Yeah?
Actually, yeah.
Okay.
Funny.
So I was like,
like that?
I like that. I'm gonna go to the hospital in the morning. So I stayed up with Sadie playing some games. At 7 in the morning, I left the house to get to the hospital. I got there about 7:30, the other hospital. Got my ultrasound done. I saw 2 doctors and I got my x-ray done, then I got my ultrasound done. Then I got my final results and I left. That whole procedure took me from that was 8 hours.
Yeah.
In that hospital, it was 8 hours. And what's funny is that, do you remember how the doctor in the first A&E, she was like, it's going to be quicker if you take the transport straight there. You know how drug dealers tell you a certain amount of time to wait for the drugs, and it's always a bit longer?
Yeah.
You know, that's how it was. That's how it is in the NHS right now. That's what the doctors do.
Yeah.
Sadly, that's how it is. If they say to you, oh, it's only going to be a bit like 40 minutes, it's going to be like an hour and a half. That's how it is. So it actually took 8 hours, which is fine. It was funny because at that point I was extremely delirious. I was sleeping for like short periods of time, like half an hour here, half an hour there. And I literally mean, look at my body. Half an hour here, half an hour there, half an hour here. I'm literally sleeping in weird ass fucking positions, like my legs up in the sky and my body on the table.
In a waiting room.
Waiting room, everything. Insane. People were looking at me weird, but I was like, I don't give a flying fuck.
Yeah, like this is a hospital. Like,
so I've been in, this is my second hospital in 2 days, you know. 14 plus 8. What is that? That's 22. 22 hours in total I've spent in the NHS's care. For fuck's sake.
One thing I will say though.
Yeah.
Like, fucking amazing that it's free.
Yep.
Because, like, do you know what I mean? Like, in Ireland now you come out with a huge cost.
Really?
Well, like, everyone needs to have health insurance. Besides, like, people do have it in the UK, right? But it's not as much of a thing because the NHS is free.
No, that's wild.
So, like, do you know what I mean? Like, I think
no,
I'm
that's
just
really sad.
very conscious of that. Like, I know technically we're paying for it and whatever taxes or whatever, but it's like, essentially though, it is free. So,
yeah. Look, let me just say, right, especially the first doctor, she was so sweet. She kept apologizing, and I'm like, no, please don't. You don't need to apologize for the waiting time. It doesn't. Honestly, don't apologize. Don't apologize, because I really appreciate your support and your help. Because, you know, Sadie asked me, how are you not going crazy whilst you're there? I'm like, well, I've got my phone, I've got my iPad, I've got my book, and I'm, you know, making the most of everything that I have. But also the fact that I'm here, it's very affirming, because I'm not here because of some random stupid accident. I'm here because, you know, I injected myself, and now I actually do get to speak to professionals. Yeah. Get myself sorted out.
Like, that's kind of what I was thinking as well. I was like, it would just be good for you to go and speak to someone about what you're doing and make sure everything's okay, because, you know, you have just had this crazy reaction to it now, you know? And it does seem as if you've had some infection from it. Yeah. So it's just good to speak to someone about it.
Big time.
At least just ease some anxiety. Because, you know, technically today is the day that you're meant to be injecting again. Yeah. And you are going to do that tonight.
Yeah. Past 12 o'clock.
Okay. Wow.
Can't wait.
Okay, that's good. I'm glad that you're, like, still...
My new needles
like, feeling good about it and everything. Cause...
So, we'll get onto that in a second, actually. So we done the x-ray. The doctor was like... X-ray looks great. Just go and wait in the, you know, the other department now. Because they sent me to one department, then to the next, then to the next, then to the next. And what's funny is, compared to the other hospital, they were like, something was wrong, okay? They didn't call my name out for anything. And they didn't call anyone's names out or anything. They did, but... They made a mistake and they didn't call my name out, and I missed my 11 o'clock appointment.
But you were there in the hospital?
I was there in the room, and I was like, what's going on? And they're like, oh, you had an appointment at 11, but, you know, for the ultrasound, but, you know, you missed it. And I'm like, oh, well, no one said anything to me, and I've literally just been waiting here patiently. And I'm like, the fuck? And they were like, no, literally. And they were like, don't worry, we'll get you sorted out. Go to the department. And I was like, okay, cool. Went there, sat there for about an hour and a bit. I fucking went to the vending machine, bought myself a Maltesers and a crisps, mature cheddar, delicious. I knew it stank because people around me were looking at me. They were like, I need to get me some of them crisps. To be fair, I was inspired by the man sitting all the way to my left. You know, it was just very like interesting because the X-rays came out perfect. The ultrasound came out good as well, saying that there's no abscess. And I was just so relieved that at the end of the day, everything I'm doing is fine, you know, and their doctors were very supportive. I'm so happy about that.
Yeah, that's really good. And that's another thing as well. It's very affirming because it's like, okay, I can go into a hospital, and speak to a medical professional. Yeah. And like, I can be like, I'm transgender, I'm injecting my hormones. Yeah. And they're going to be like, okay, let's take you to let's they're gonna hear, like, they're just gonna take that as neutral information. They're not gonna be like, oh, transgender in a minute, like, do you know what I mean? Like,
Yeah.
it's crazy. It's like on a very like neutral scientific
Yeah.
basis. It is fully recognized
Yeah.
within like biology,
Yeah.
medicine,
Big time.
science. Like a hospital, if like, I don't know, it just makes it even more like, everyone out here saying shit is like.
It's really nice, yeah.
Yeah, so it's very affirming. I can.
I
Totally see
appreciate the professionalism of all
that.
the doctors as well,
Yeah.
and the support.
And then like, so when do they actually say to you, it looks like you had the early stages of cellulitis?
That was in the first night.
The nurse you were speaking to was like, okay,
the Mishmish's
right.
owner.
So there wasn't really any exact. She didn't know for certain, but she was like, I think this is what it is, or that's what it looks like.
Right, and the way cellulitis is a bacterial infection, so the way you treat any bacterial infection is with antibiotics. Yeah. So that's all you have to do.
It's just
really.
amazing that, like, or I think amazing is the wrong word. It's just so fucking relieving that it didn't go further than what it did.
Yeah.
You know what I mean? Like, it's just, thank God.
Big time,
you know,
honestly.
That it wasn't any worse.
It was terrifying, though.
Yeah. No, really, because you're already doing something that's, like, a bit like, ooh, I have to inject myself.
Considering also that prior to me injecting, I spoke to 3 health professionals who all denied to give me advice on how to inject.
Which health professionals?
The doctor and the nurse at the sexual health clinic.
Why would they not give you advice? I didn't know that.
Because I was doing it myself and not on the NHS.
And they're not allowed to say.
Exactly.
Wait, seriously? You never told me about this?
Yep.
You never told me this?
I might have or might have not.
Oh my God! So
maybe it was just them two.
But is that more just legally? They're like, we can't legally give that.
Yeah.
Because are they even trained in that?
Yeah.
They're not trained in
No,
it.
they are.
Oh, they are.
Yeah, they are.
But legally, they couldn't tell you because they don't recommend it.
Yeah.
This was the thing when I saw what happened. Obviously, with what happened with you, I was like, are you sure it is 100% safe to do it at home? And you're saying it is safe. It's just that, like, the NHS wants you to come to them to do it. Yeah. Okay.
And obviously, don't get me wrong, like, me and Venus spoke about this prior. She said if you was doing it with the NHS, would they want you to do needles and stuff? And I was like, no. In this country, the NHS doesn't prescribe injections. Even private healthcare does not prescribe injections. And I think it's due to the fact that we're not in the EU, 1. 2, it's about creating the medication in this country, and I don't think that's something that's very feasible. I don't think they do that. And 2, I don't think it's very cost effective, because you've got the needles and then you've got the vials, you've got so many different things. Whereas
I just feel like it's not. I can't see it being the typical, or what's the word? I can't see it being like the standard for just your regular everyday person because it is quite overwhelming. We saw it you really researched, you did what you had to do. You still made one teeny mistake, but then led to this happening. So I feel like that for that reason, they probably would maybe that's part of why they don't want you injecting at home. I mean, this is like what I think about with the fucking blood test, the at-home blood test. Where I'm like, how the fuck is that a real thing?
Terrible.
Like, do you know what I mean? Like, these little things. Now, I guess with the blood, it's like, technically no infection is going to enter into you. But, like, well, it could.
Yeah,
but,
it could,
it's more just the fact that, like, how am I supposed to fucking bleed my finger dry, like, at home like this? Like, isn't that
fucking milk your arm.
But, I mean, if it works for you, it works for you. But same with the needles. If it works for you, it works for you. But maybe I can kind of see why they would be like, oh, pills, it makes more sense for the everyday person, the typical who because injections could go wrong. Imagine, like, it might cause a lot, like, I guess in a sense it's not as safe, is it, as doing pills, as taking pills?
Probably not, babe. Look, if I'm honest with you, if I could choose to do pills or injections, I would just say I would do injections.
And the reason you don't want to do pills is because it's not the results are not as...
People, like, studies show that the efficacy of pills versus injections, and I'm probably wrong here. I think the study that I'm thinking about is pills versus estrogen patches. The efficacy is relatively the same, and I don't know if there's enough research to look into the efficacy of pills versus patches versus injections. But from a small consensus in the echo chamber of the internet that I'm in, people say that from their experience, injections are more effective
in order to like
to feminize yourself.
Okay.
Right. Specifically to see like changes in your body,
Yeah.
whether it's your breast developing, whether it's your libido changing, whether it's your skin softening or your something changes to your hair, stuff like that. For me, right now, if I have to say which one I would rather do, I would rather just do injections because I have them with me.
Yeah, of course.
You know, it was hard enough getting them.
Yeah.
And I think the thing about the injection is that I don't have to take a pill every day. Okay? I don't have to take a pill every day. I don't have to stock up on pills as often. I don't have to inject weekly or every 10 days. I have to do it every 21 days. That's fine. And I don't want to be thinking about it. You know, I just want to get on with my fucking life.
Yeah, exactly.
You know, and that's my thing.
I was thinking about it like when you were in hospital. I was like, gosh, it is like it's already hard being trans and having to go through like these medical procedures and stuff. Never mind then all the fucking voices of people saying that you shouldn't exist, right? Like there's just so many. There's already like a difficulty to it.
Yeah.
Without having fucking the whole, like a big portion of the world being like no.
And then, no, literally, and then there's the additional voices that came into my head in the past 2 weeks where it was like, look, you just fucking injected yourself with some random fucking, you know, medication from the fucking internet, and now you're having adverse reactions. You're gonna go to the hospital. You might fucking die. You don't know what the fuck is going on. Medical professionals don't give you advice.
I mean, I guess a part of me was like, fuck, I hope everything that you got was safe. But like, you were already so sure that it was.
And and prior to that, babe, I was feeling like super depressed, and now I think about it, it maybe is like, because what happens is after you inject the first like 2 weeks, the biggest reactions or the biggest changes you see, I don't know about testosterone, but for estrogen is that you have like instability in mood. Keep that in mind, instability in mood, and your nipples are sore. They start budding. So my nipples have become, you know, sore, they're budding, and looking back, there was instability in my mood. Like I was feeling really down, very depressed, you know, like, and then kind of motivated, pumping out a lot of content, recording a lot, feeling happy, feeling sexy. Oh, I feel like I'm going to die. Oh, I want to kill myself. Oh, what's the point of anything? Looking back, it all makes sense. Because, you know, when I was in the hospital, I was so scared. I was so sad. I was like, why did I say I want to die? Why did I say I want to kill myself? I don't want to die. I don't want to kill myself. You know, I was like freaking the fuck out. You know, I was like so scared. But after going through all of that, I reassured myself something. The fact that you're waiting in A&E this long, and to anyone who's listening out there, yes, the NHS is in a bit of a pickle, but if you are waiting in accident and emergency services for a long amount of time, that's a good thing, because that means your situation is not dire. If your situation is fucked up, they're going to see you as soon as possible to prevent you from dying.
Yeah, so
but
if you kind of were like, that was a realization for you that you were like, you know what, I think I'm going to be okay.
Yeah, because you're not dying.
Yeah.
You know, someone's going to see to you, just wait. You know, they have to let their processes figure out which department do you need, which specialist do you have to see.
Yeah.
Is this specialist even in the hospital, or which department are they in? Because what happens is the doctor will be walking from A to B to C to D. If you've watched shows like House, the doctors are always on the move. That's how it is. It genuinely is like that. The doctors are on the move. They're doing something in this department. Okay, cool. They got an appointment with another patient. Okay, cool. Done. Okay, cool. They're literally zigzagging throughout the hospital. They will come to see you. Even if in between it takes like 20 to 30 minutes with each patient, they will come to see you, right? And who knows, maybe in that hospital, they've only got that one specialist doctor. Maybe they've got 10, right? It doesn't matter. It's always, it's very different. So in my case, I feel like the orthopedic doctor, there was maybe only a few. and she was the one at hand. In the other hospital, there was a different amount, you know, and I was seen faster in certain departments, slower in other departments. Overall, I'm just so happy that it's all done with.
I think I'm just happy to be alive, and I have
happy to be alive
after having a near. I don't want to say it was a near-death experience.
Yeah.
I think if anything, like maybe if you had texted me about it like the day before, or maybe like 2 days before you actually did, I would have been like, because I already was like, okay, this is concerning. I think just the fact that it happened and knowing that you have to inject again is the reason why I was like, I think you should like talk to someone or figure out what happened. But if you had texted me a few days earlier to that when it was really starting to flare up, I would have been like, oh my god, fuck, she has cellulitis. Like, fuck, like you need to go to the hospital right now. Go now, like, you know what I mean? But I think just knowing that you had to inject again, that's why I was like, okay, I think you need some advice, or you just need to know that what you're doing is okay.
Right.
So, yeah. Anyways, you're injecting tonight.
Yes. So one thing I've learned, although I was being patient with myself last time injecting, there was one instance where I wasn't being patient, and that's what led to me going to the hospital. That was me not cleaning my area properly, which I did again and again. And then the final time when I did it, I didn't actually clean the thigh.
Will we insert a photo of what it looked like?
We can.
Over the thing. Okay, we'll already have done that.
Yeah. So,
I mean, right now it's still red and inflamed, but it's not.
It's gone a lot better.
But like, I can see it now. I wouldn't notice it otherwise if I didn't know. But can I touch it?
Yeah, you can touch it.
Oh, it is hot. Yeah. It is like hard.
Yeah.
Let me feel your other leg. Yeah. See, that's like soft.
Look at the color difference.
It's crazy.
And look at the fishnets.
That babe.
Stretch.
That like. As much as it wasn't too serious, like I feel like no matter what, it is.
Can you imagine
because it's your
in person, babe?
Like cellulitis attacks the tissue, doesn't it?
Yeah. Can you imagine, babe, how bad it was?
How much bigger did it get? Like, use your hand. Oh my god, babe.
It was like fucked up. Sadie like fully like could tell you like.
Okay, we'll insert a photo.
Right.
Yeah.
So in the original injection, I injected it very quickly. Right now. We might have mentioned this in prior weeks to where the thickness of the needle is measured in G's. The shorter, the smaller the number, the thicker the needle. So the injection I used to draw the medication is 18G, and the injection needle was 23G. Oh, that was thinner. But I've opted now for a shorter needle and a thinner needle. So now it's instead of 23G, we're looking at 27G.
So hopefully everything...
The only difference now, babe, is besides it being shorter and thinner, it's going to take longer to inject.
Okay, well...
Which is fine.
Look, it is trial and error, as is everything.
Yeah.
And obviously when it comes to your own health and like something as serious as like bacteria in your bloodstream and all that shit, like it's not just trial and error. It's not, I don't want to say life or death, sorry. I'm just jumping from one extreme. No, it's yeah, I think, you know what, babe, I think that you've handled this situation really well. I think it was a scary situation, but you know what, like you're a little trooper. You're a fucking, what's the word, you're a warrior. And you stayed, you know, brave throughout it, and you're going to carry on now, and you're like, you know, no, fuck it, I'm not going to let it stop me. And I've now learned how I need to be a little bit safer, a little bit more cleanly, don't use cotton pads, etc.
Let it dry.
And yeah. Now, the thing is, we were actually going to get into a whole nother thing. I think we're going to have to leave that for next week's episode.
Right.
Let's just say one of Ayesha's clients' wife got in touch with her. Crazy. We'll have to get into that next
You know, she
week.
double texted me.
Well, yeah, I saw that.
No,
she texted you since?
You know how I ignored her?
Yeah.
She texted me again after that.
But did you not show me?
No.
Okay, we'll get into this next week. Yeah,
yeah.
We'll get into the whole thing. So stay tuned for that, because
Yes.
sometimes, you know, being an in-person sex worker, this is what you might come across.
Yeah.
Or just a sex worker in general.
Yeah, big time.
Anyways.
It was lovely chatting to you guys.
Yeah, I'm glad that you got to kind of just speak about your hospital experience and everything that happened to you. Just in a bit more detail. Yeah. And I guess raise awareness in a sense too.
Yeah.
Just ongoing, like, you know, raising awareness about trans health and stuff.
Let me just say though, I'm very glad as well that you spoke about Wuthering Heights.
Oh my god! I was just like, you know what? It's topical. Everyone's speaking about it.
glad.
There's controversy, a lot of criticism.
Yes.
Yeah. So, yeah, we really enjoyed chatting again.
As always.
Two bops just bopping and chatting and fucking and sucking. And what happens when two girls reunite after so long to discover they're both sex workers? They start a podcast.
Ta-da!
Thanks for listening, guys.
Leave us a comment on what you thought about the episode.
If you watch Wuthering Heights, if you want to give Ayesha some words of encouragement after what she went through.
Oh, wow. I would love that.
Just a very, like, we talk about a lot of different topics, you know? But yeah, no, like, I can't believe, like, when you were in hospital, we were like, you know what? At the end of the day, it's content for the podcast.
Yes, indeed.
Tune in next week to hear about Ayesha's fucking...
That was fucked up.
Getting dragged into a marriage,
That was...
I guess you could say. But...
Am I a homewrecker? We'll
all I'm
find
going to
out.
say is, this man, piece of trash.
Yeah.
Just, ugh.
I'm not
Disgusting.
a homewrecker. He is.
Disgusting, yeah, no. Oh, God.
We'll get into
Anyways,
that next week.
We get into that next week, so come back next Wednesday. And anyways, thank you for listening,
Thank
guys.
you.
Bye.
Bye.
Ciao.
Ciao.
Mwah. 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 Mwah.
Ah, ah, ah.